Hello, my name is Dr. Greg Symko, and I'm going to talk about why, as we get older, um, our joints tend to ache, or we tend not to have as much energy, or doing things like raking the leaves in the yard really exhausts us and makes our back sore. Well, as we age, well, let me go back to first explaining something about how our body works on a very basic physiological level. In other words, on the cell level. Each cell has little, what we call organelles. That means little tiny organs that produce all the things that our body needs to function properly, or the cells need to function properly. And one of these things is called mitochondria. Mitochondria is sort of like a factory where it takes foodstuffs or enzymes and protein and what have you and make energy, or energy that our cells can use. And this energy that our cells can use is called adenosine triphosphate, or ATP for short. ATP is our energy, our body's money. This is what we use, our coal, our oil, whatever you want to call it, to make our cells function normally. Now, the thing about ATP and this production of ATP is our body does that, and it uses foodstuffs that we eat, good food, in order to produce it. Now, the interesting thing here is that studies have shown that we as humans lose the ability to produce ATP by 1% of a year of life. And it starts being reduced right away as we're born. So, in other words, a 20-year-old will have lost 20% of his or her ability to produce ATP. And a 50-year-old would have lost 50%. An 80-year-old will have lost 80%. Now, that's significant. So a 20-year-old can't or doesn't produce 20% of the ATP that they produced when they were 1. They can overcome a lot of significant hardship or physical output because they have a reserve of this adenosine triphosphate, ATP, to help heal their bodies, to help function, not to be tired, to do things, to have the stamina to be able to do stuff. Now, say for instance a 50-year-old. Now, a 50-year-old will have lost 50%. Now, someone that lost 50% as opposed to 20%, the 50% person doesn't have as much reserve to be able to do the things that someone who only lost 20% does. Now, that's under normal circumstances. What happens if we don't treat ourselves right, or we have trauma or stress or certain kind of diseases? Our ability to produce ATP becomes even more diminished. When you can't produce energy, you can't function properly, and you can't function well, and you don't have the stamina to do the things that you used to be able to do when you were younger. That is why, as we age, it is very important to be able to take care of ourselves properly, to eat well, to not cause unnecessary trauma to our bodies, so that we can produce as much ATP as possible. And what they've discovered is that there are certain foods that can actually cause our bodies not to react properly or not to produce ATP properly. If your immune system is compromised, if you have what's called an autoimmune disease, if you have dysglycemia, which is basically imbalanced blood sugar, you have a deleterious effect, a bad effect on your ATP production. So, leaving you with this information, what can you do for yourself? Well, one, you can eat better. Don't eat as much sugar. Get off of inflammatory foods, which I haven't talked about, and I'll talk about later at some other videos. Inflammatory foods actually cause your immune system not to function properly, which can interfere with ATP production. And one of the most inflammatory foods of all, believe it or not, is what's called gluten, which is found in wheat, barley, and rye. That pasta, that white French bread, all that kind of stuff is actually not good for you and not good for your immune system. So those are the things you can do for yourself. Reduce the sugar, reduce gluten, and you'll probably feel a lot better. Other than that, if you have even still more problems, find a physician that knows what the heck they're talking about and can deal with this problem. Thank you, and have a great day.